You have a runny nose, congestion, coughing, headaches, it could be sinusitis. 30 million adults suffer from it in the U.S., and it often coincides with winter months. You can likely handle these symptoms on your own, but when should you seek medical attention? We welcome Dr. Joseph Brunworth, a SLUCare otolaryngologist and rhinologist. Good morning to you, sir.
Good morning, Randy.
Well, let's talk about the symptoms first. They sound like they could be a cold, or someone might even mistake it for COVID. Do some people sometimes mistake these for symptoms for something else?
Absolutely, yeah. From allergies to the flu, a cold, COVID, all of these have overlapping symptoms. So it can be important to seek medical attention if things get worse instead of better, or if you think you've had an exposure. It is worth going in to see your primary doctor at that point.
So how do we know this is indeed sinusitis? Is there a specific symptom that stands out? And how long should we deal with the symptoms before we end up calling you?
There are certain things that lead us to assume that this is sinusitis rather than a cold. A few things would be, for example, after 3 to 6 days of having your fevers, your cough, your shortness of breath, what you might have with a typical cold, then suddenly, instead of getting better and better after that point, it starts to get worse and worse, and you get more congestion, nasal discharge coming out, you're blowing your nose, lots and lots is coming out. And if it continues after 10 days or a couple of weeks, then it's time to seek attention.
Yeah, that's a long time. What about over-the-counter remedies? What can we do to maybe treat ourselves that it hopefully won't get worse?
Well, some of the overlapping symptoms with allergies can actually contribute to sinusitis, and that's why a lot of the over-the-counters can actually help. So, for example, allergies might cause your sinuses to kind of close up temporarily because of the swelling of the mucosa inside of your nose. And so things like Zyrtec, Allegra, Claritin, Benadryl, nasal decongestions. Sometimes you can use even a nasal decongestant spray, but only for 3 days. Things like Sudafed if you don't have high blood pressure. Some of these types of medications are over-the-counter, can help with temporary symptoms as well as sometimes avoid a sinus infection.
Yeah. Are people kind of having concerns about coming in to seek treatment for this? Well, because of COVID?
Absolutely, yeah. We've had a run of patients recently that ended up kind of holding off for as long as possible, but now are coming in with sometimes complications from sinusitis. Now, it's rare, but we've had patients where the sinus disease starts to go towards their eye, up into even through the skull base towards the brain, and these can be serious infections. Yeah. So if somebody's having really high fevers, really intense pain, bright lights affect them, they get a stiff neck, or if they have eye swelling, redness, all of these really vital signs need to be seen by a doctor ASAP.
Wow, some great advice, doctor. We appreciate your expertise this morning. Stay warm. And for all of our viewers who need more information on this, we will link you to slucare.edu on our website as well as our Fox 2 mobile app.